So my name's Tom Hardy. I'm a consultant vascular surgeon in Exeter in the southwest. I've been in post for about a year now. I've taken a slightly longer route to get into medicine and to get to this point. So I didn't really know what I was doing when I left school. My brother was a doctor and he was quite an intimidating character in terms of how much he worked. So I was like, well, I could never go into medicine. So I kind of did biology and then went abroad for quite a few years. I was a teacher. Then while I was abroad, somebody gave me a bit of a kick up the backside to say, well, look, if you wanted to go into medicine, that you could do it. And that kind of inspired me to start exploring that path. So I think when I got to medical school in Warwick, which is a postgrad school, I was interested in paediatrics because I'd done teaching. I was interested in fertility medicine. I think that procedural side of stuff, when we started learning about it, is what really kind of got me a bit more excited and started moving me towards surgery. And I think my first placement was in vascular surgery in Coventry, and that was great. I got to go to operations. I can remember holding the femoral artery on a patient who was having an EVAR by the vascular consultant with no interventional radiologist there. This was quite early in the uptake, I think. I was like, oh my word, like I'm literally holding this patient's blood vessel in my fingers, and if I let go, they're just going to bleed. So that was quite petrifying, but also quite exciting. And I think I kind of got pulled along into vascular by inspirational characters and people that have pushed me hard and made me see what I can kind of do. I think that's what's kind of drawn me to this specialty in the end. So I said I went to Leeds initially. I'm from the Midlands, followed my brother to Leeds University and did biology there. While I was there, in my first year, there were a load of students there from Penn State University, and my brother went on his medical elective to America, and I went to see him to travel with him for a month, and on the way went to see these guys in Penn State. I just really enjoyed kind of that experience of being in an American university, and ended up going to North Carolina for a year as part of my degree. And that traveling abroad and living abroad, I really enjoyed, and I didn't really know what to do after I'd finished my degree. A friend had gone on this thing called a JET program, which is the Japanese Extension Teaching Program. And she was living in some village in the middle of nowhere in Japan as a native English speaker, as an assistant teacher. And I was like, oh yeah, okay, I'll have a go at that and see where that takes me. And ended up in the southern tip of Japan, basically on a tropical island of 50,000 people, and spent 3 years as a teacher there. And that was absolutely fascinating. I had a great experience there. I think all these things of living abroad and having these experiences really kind of shaped me a lot. And I think people get very nervous about going abroad, even when they're in medical school or when they're post-foundation or post-core. I just think it's one of the most rewarding experiences you get, and it actually rounds you out so well. So I think those experience I've had of living abroad has been really influential in where I've kind of gone further down the line. My favourite vascular operation? Oh God, I think it changes a lot. I think at the moment I do quite like an open aortic surgery. So a nice open tube graft that all kind of falls out very nicely is very satisfying. I'm just waiting to get burnt by something to make it even scarier though, and then it'll be something else and I'll move around. So I think that's it at the moment. I love it. I think I feel really privileged to have gone into this career, and that people have trained me to get to the point that I am. Registrar life, I felt, is incredibly pressured. There's always something to do. You're always trying to impress. You're trying to fill out your CV. You're trying to get the projects done, and you can very quickly get overwhelmed by that. It's very difficult to manage all that stuff that you have to do. And you have to do a lot. You've got to learn a lot in those years. I think as a consultant, your lifestyle starts to ease up, because a lot of that pressure, you have different pressures, but a lot of that pressure is removed. And also, depending on where you work, I've got fantastic colleagues, which I think is absolutely essential. And I enjoy going to work, so I enjoy seeing those people. I enjoy just chatting to them, and especially during COVID, I was very lucky that I had that outlet, that I could see people and have conversations that most people were not allowed to do. You certainly don't do as much operating as you do as a registrar. You do a lot more clinical work, you see the administrative side, you feel a lot more ownership of your patients. You're seeing them from first presentation to your decision making, to counselling them, to operating, and then seeing your results. And that's really scary that you have that much responsibility, but it's very rewarding when everything fits together and works, and you can see that the skills that you've learnt and the teamwork and everyone that's come together to kind of get patients through something, which I can't understand how stressful it is for patients going through what we put them through. I think it's very difficult to be understanding of that, because I've never had major hospital admissions or anything where I've had to go through big operations. So it's I think it's a very privileged position that I'm in now, and my lifestyle is very, very nice at the moment. I'm allowed to say that. I play poker, which is a bit dodgy. So I enjoy it, and I've done this since university. I basically go to a pub once a week with a bunch of people that I don't know, pay my £5 or my 20 quid, and you sit in a pub for 3 hours as an anonymous face. They don't know who you are. They don't ask questions. You just listen to people chat, and you can be as engaged with them or as unengaged as you want to. I've loved playing poker. I think it's a fascinating hobby, a fascinating game. But I just enjoy that experience of being an anonymous face in a room where you can just relax. You don't have to kind of worry about talking about medicine and people worrying about who you are or what you're doing. You can just be a nobody. So I love that. So that's one of my things that I do every week if I can. When I was in Japan, I got into triathlon. So we did a lot of long distance races there, kind of like Ironman type things. And I've tried to kind of continue that as I can. I think as a consultant, your life starts to free up a little in some ways. So I've managed to start getting back into that. And certainly that's something I really enjoy, is just getting out on the bike and trying to get out and running and swimming a bit more. But yeah, that's what I do in my free time at the moment. I think that is difficult. I think I try to exercise. I feel like I have to be selfish, which my wife isn't quite as good at being selfish for herself, because especially when you've got a kid, a lot of your time is taken up. Like even if I get home at 5, it's bath time, bedtime, feeding him, getting him to sleep, and then feeding ourselves. It's suddenly 8:30. So you've not got much time. So you've got to say, well, I'm going to do this while you're looking after our son for a bit, or vice versa. You've got to kind of be a bit selfish to make sure you take advantage of those opportunities to, I say, get on the turbo and just do 45 minutes on the bike or something. It's really important. Or having an evening out like I do is essential. You've got to be almost quite strict with yourself to keep that going. So if you get out of the habit of doing it, it can feel really difficult to get back into the habit of doing sport or hobbies. And then that's when that burnout comes, and that I think that can be really hard. So that's how I try and de-stress. God, I think there's a myriad. I feel so lucky that people have taken the time to train me to where I am. I'm a product of so many people and so much different input. I've got to put the time in as well, but I feel I'm so lucky that people have taken the time to get me to where I am. I can't believe what I can do now as a consultant, doing like your first open rupture and seeing that patient come through. Like, no way as a medical student or an F1 would I ever believe I could get to that point where I had the skill set, the confidence, the decision making, the team working to get to that point. That's incredibly, I find that very rewarding, and that's why I find training very rewarding as well. And seeing people, trying to pull people along, show what the specialty is, get people inspired by it is fantastic. The other thing I love with Vascular is it's a small community. And you come to these conferences, which I find very intimidating still, but you see the same people, you see these same friendly faces because you've worked around the region in the Southwest, and there's 20, 30 people here that immediately I can go and have a chat to and see how they're getting on. And that small community feel, you feel like you're part of the gang. I don't know whether with colorectal orthopedics you probably feel a bit lost in the thousands of consultants and trainees that they've got. This little tight-knit community we've got of passionate people that want to do the best, want to train, want to draw people through is fantastic. So it depends what you're comparing it to. I mean, certainly there are other specialties which have a much better work-life balance. Even in surgery, we do get called in the night. And if you have to come in and do something, it's usually scary and it's long. If you've got to do a major operation, you're going to be there for 5 hours. And a lot of the time you're going to be doing it by yourself. And it's that self-doubt is always there, that imposter syndrome that I try and highlight to medical students. That I feel that still, that I'm not good enough, and that's okay, because you've got to believe that actually everyone else thinks you're all right, so you should be fine. So I think that out-of-hours stuff is tough. I think the decision-making is really hard, and it's unforgiving in vascular. That kind of get it right first time is they're right. And if you get it wrong the first time, it becomes exponentially more difficult, and you can get into trouble very quickly with vascular, and things can get out of hand very quickly. Mitigating for that, and I've definitely learned that very quickly, that although you talk as a trainee about the plan A, plan B, plan C, like I'm formally working all that out in my head before I go to an operation, and it's set up in theatre, and I've got it really clear where I'm going and what the other options are. So yeah, I think that uncertainty, the on-call, I think geographically it's tough for training. I think we work in big deaneries as registrars, and that is difficult. I certainly moved 5 times in the 6 years of my registrar training, from Plymouth to Taunton to Bristol to Exeter, and then commuted to Bristol for my final year, and that's hard. And that has implications on your partner and potentially family and things like that, it's difficult to settle in the larger deaneries, kind of buy a house and feel that you're kind of settled in one area is quite hard. But for me, the rewarding bits far outweigh any of the drawbacks. And you know a lot of this when you come into it. If you enjoy something, those things that you'll see in all specialties, and everything has their drawbacks, they are easier to tolerate. You're more resilient to those problems, I suspect. I think you've got to see what we do. So getting placements, even if it's on an SSM, you've just got to come to theatre and see what we do, because that's the interesting bit. That's what we love. And seeing the anatomy, which is, it's rare you get to see such clean, beautiful anatomy, or sometimes, maybe not in my hands, but seeing what we do is really essential. I think the Rouleaux Club has now got a ton of things for medical students. The Introduction to Vascular Surgery course, which is running numerous times a year, is a fantastic resource. The essay competitions, the getting onto the website to see what we do, the amount of materials out there to help them learn through things like Aspire Junior. And it's approaching the units, because most of us are friendly people, I think, and will want to pull people along into the specialty. So it's asking around and finding those vascular trainees that will, again, I say, just bundle you up and pull you along for the ride, basically. I think it's really important. You've got to have something outside of medicine. I always tell people, I think it's really important to have that, whether it's traveling, whether it's hobbies, whatever it is, you've got to know how to de-stress your life and how to reset yourself. That is absolutely essential, especially in vascular, where there is quite a lot of pressure and there are stressful patients, there are stressful decisions to make. You've got to be able to decompress in some way. And whether that's, I say, travel or hobbies or sports or whatever, you've got to find out what that is for you and make sure you don't give up on that, because it's really essential, I think.